The worst heart health advice cardiologists have heard. When it comes to heart health, there's no shortage of advice, but not all of it is accurate. To clear up the confusion, we spoke to leading cardiologists about the most common misconceptions that could be putting your heart at risk. Heart disease remains the #1 cause of death in the United States, yet misinformation about maintaining heart health is rampant. Here's what top cardiologists have to say about the most pervasive myths. Myth: chest pain is the only sign of a heart attack. Contrary to what you see in movies, a heart attack doesn't always come with dramatic chest pain. Many people, especially women, experience subtler symptoms like jaw or shoulder discomfort, nausea, or even indigestion. According to Dr. Amy Pollock from the Mayo Clinic, around 40% of women report these atypical symptoms during a heart attack, often without any chest pain. Myth: women are less prone to heart disease. While it's true that heart disease affects more men, it is still the leading cause of death for both genders. Many women mistakenly believe that breast cancer is their greatest health threat. However, Dr. Carol Watson from UCLA points out that women are 13 times more likely to die from heart disease than breast cancer. Myth: a low-fat diet is best for your heart. The idea that cutting fat is the key to heart health is outdated. Dr. Pollock explains that while it's important to avoid unhealthy fats like those in fried foods and red meat, healthy fats from sources like salmon, walnuts, and avocados are beneficial and can actually lower your risk of heart disease. Myth: supplements can prevent heart disease. The supplement industry is largely unregulated, and many products make claims not supported by science. Dr. Stephen Neeson from the Cleveland Clinic warns that some supplements can even interfere with prescribed medications or be harmful in large doses. Always consult with your doctor before taking any supplements. Myth: daily aspirin prevents heart disease. Taking aspirin daily used to be common advice for preventing heart disease, especially for men of a certain age. However, Dr. Neeson notes that recent studies suggest this may not be effective unless you already have heart disease. Even then, it's essential to consult your healthcare provider before starting aspirin therapy. Myth: statins cause diabetes. Statins, which are used to manage cholesterol, do not cause diabetes. Dr. Watson explains that while statins can slightly raise blood sugar levels, they don't trigger diabetes. Instead, statins significantly reduce the risk of cardiovascular events in people at risk for heart disease. Myth: vegetarians are immune to heart disease. Plant-based diets can reduce the risk of heart disease, but not all vegetarian diets are healthy. Dr. Mike Hose points out that a diet high in refined grains, sugars, and processed foods can increase heart disease risk, even if it's meatless. A balanced, whole foods-based vegetarian diet is key to heart health. Myth: caffeine is harmful to your heart. Caffeine, in moderate amounts, is safe for most people and may even benefit heart health. Dr. Mike Hose references studies showing that up to 300 milligrams of caffeine daily, about 3 cups of coffee, can be part of a heart-healthy diet. However, it's best to avoid caffeine-laden energy drinks, which can have adverse effects. Myth: you don't need to worry about your heart until you're older. Heart disease develops over time, so waiting until you're older to take care of your heart is a mistake. Dr. Salim Virani from Baylor College of Medicine emphasizes that even children can start developing arterial plaque, making early lifestyle changes critical for long-term heart health. Myth: you should take it easy after a heart attack. It's natural to want to rest after a heart attack, but Dr. Virani says that getting active is one of the best ways to recover and prevent future heart issues. Cardiac rehabilitation, which includes regular exercise, can significantly reduce mortality after a heart attack. Myth: normal blood pressure means you don't need to worry about salt. Even if your blood pressure is normal, reducing salt intake is beneficial. Dr. Nika Goldberg from NYU's Langone Medical Center advises that less sodium can help prevent blood pressure from rising as you age and reduce the risk of other conditions like kidney disease. Most dietary sodium comes from processed and restaurant foods, not from a salt shaker. Dr. Goldberg suggests reading labels and focusing on fresh, whole foods to reduce sodium intake and protect your heart. Myth: a little extra weight is okay if you're fit. Carrying extra weight can increase your risk of heart disease, even if you're otherwise healthy. Dr. Baum notes that recent research shows a 28% higher risk of heart events in people with excess weight. regardless of fitness level. Myth: heart disease is a death sentence. Advances in medicine and lifestyle changes mean that people can live long, healthy lives with heart disease. Dr. Neeson points out that with proper management, heart disease is largely preventable and manageable. By dispelling these myths and understanding the realities of heart health, you can take proactive steps to protect your heart and live a longer, healthier life.